Have turned to this man, Leslie Michelson, for advice on how to get the best kind of medical care. And now he is spilling the secrets with the rest of us in the patient's playbook. And you really were a consultant to the people you refer to as the 1%, the top strata in this country.
I have for the past 3 decades. I've helped thousands of people get better medical care, and I built a business called Private Health Management where we frankly get retained by people of means. But I've seen the difference it can make when people become effective healthcare consumers, and people have this notion that the very best medical care is reserved for the 1%, and that's just not true. In my experience, the people who get the best medical care are the savviest healthcare consumers.
And you have some great advice in this book. Let's go over a couple of ideas. You say keep an inventory of your records just in your wallet. Now, and I've heard keep it on your smartphone. My smartphone's locked, and I suspect yours is too.
True.
So if I'm lying on the pavement with a paramedic standing over me, the thing's locked up. If it's in my wallet, they can find it.
Yeah, so what I do is I've got all my medical records on a UBS card I keep in my wallet all the time. I travel a lot. Here are all my medical records. You can get them anytime. So if that, God forbid, awful situation occurs, I've got it available. And people can do it different ways. But, we prepare for all kinds of things. In Dallas-Fort Worth, you've got tornadoes, you've got ice storms. People are prepared for that. In California, we've got earthquakes. But people don't prepare for medical emergencies, and it's easy to do.
Right, and one of the things that you say is if I am facing an urgent, a significant health crisis, God forbid, I should go to a significant doctor and a significant hospital. What's that mean? Well,
throughout life, experience matters and practice makes perfect. And if you've got a complicated problem, surgery for a cancer, an abdominal or an aortic repair that you need to have done, brain surgery, those shouldn't be done at a community hospital. Community hospitals are great for routine procedures, but something with that degree of technical sophistication should only be done at a major academic medical center by a physician with deep experience in exactly that procedure.
If my child is sick and if it's a sinus infection, it's one thing, but if it's a cancer diagnosis, should I go to a children's hospital?
Children's hospitals typically have much greater expertise in particular conditions. But the great thing today is there are fabulous resources online available for you and everyone else that are free, that you can go to, that can give you the identities of the physicians and hospitals in your community with the experience that your child
And you list those, and we're going to put those up as a link as well, and it's a great resource. And I have to confess to you that the list that you gave us were 5 websites I'd never even heard of, and you say those are the places to go if you want to find the right doctor or the right hospital. A lot of new consumers out there, thanks to, or because of Obamacare, a lot more people are now in the healthcare marketplace than have been in the past, but they're not savvy consumers.
Right, and it's important for everyone, whether you're newly insured, you've had health insurance for decades, it's important for everyone to change how they deal with the healthcare system. Biomedical research is exploding with far new technologies that are terrific for people. If you're a savvy consumer, if you learn how to find the physicians with the experience for your condition, you're going to get much better outcomes, and it doesn't cost any more.
Is the internet the worst thing or the best thing that's happened to healthcare? People going on and saying, boy, I got this headache, it must be a brain tumor.
It depends on how you use it. You don't want to become your own physician, but what you want to use the internet for is to learn how to partner with your physician, to learn how to find the best physicians, to learn how to educate yourself about your condition.
I don't want to hurt his feelings.
No, but we go through in the patient's playbook scripts of how to be respectful to physicians so that you can tell them that you're going to be their partner in your medical care. And when you do that, they will welcome it. Great advice, and you can find a link to the patient playbook on Fox4News.com. Little bonus from Leslie Michelson, the 5 must-visit websites when you are facing a serious medical situation. And don't be a hypochondriac, but, take care of yourself. Thanks very much. Thank you. It's great to be here.
Great advice. Nice.